I am Dr. Charumathi from Department of Public Health Dentistry. As a healthcare professional, dentists play a vital role in empowering individuals as well as communities towards better oral health as well as general health. Health education is an essential tool that helps us to achieve this goal. In this video, we will explore about the principles of health education and its positive impact on empowering these communities. Let's get started. These are my contents, which include introduction followed by definition and the principles of health education followed by conclusion. Coming to health. What is health? Health means being disease free. A healthy individual is known by his nature that he is disease free. But according to WHO, the definition states that health is a state of complete physical, mental and social well-being and not merely a state of absence of disease or infirmity. So, which was given by World Health Organization in 1948, followed by the definition of health education. Health education is an essential tool and integral part of public health that bridges the gap between health knowledge and practices among the community. And health definition was given by National Conference on Preventive Medicine in 1977, by which states that it is a process that motivates, educates and imparts knowledge to the people to adopt and maintain healthy practices and lifestyles, and it advocates environmental changes as needed to facilitate this goal and conducts professional training and research to the same end. So, the principles of health education are credibility, interest, participation, motivation, comprehension, learning by doing, known to unknown, good human relation, reinforcement, feedback, community leaders, soil seeds sower and setting an example. First, we will see about credibility. Credibility is the first principle of health education, which states that the information that is given by a health educator should be trustworthy for the receiver or the community. And this information should be scientifically proven by facts and should be culturally acceptable by the individuals who are living in that area. So, it should be more reliable for the population to be first accepted by them. Second principle is interest. If a health education topic is of interest to the people, people will listen to it. And usually, if a health education topic if it is to be interesting, it should be a felt need of the population. Felt need is nothing but the requirement or the care that is needed by the receiver or the community. The health educator should first find the felt needs of the people and then prepare a program that can actively participate in it to make it successful. So, this is the second principle, that is interest. Next one is participation. It is the key word in health education. So, health education should aim in encouraging people to work actively with health workers in identifying their problems and also to develop solutions for the same. So, participation should be encouraged from the receiver end so that it makes an active learning process. Usually, an active learning process is more successful when compared to a passive learning one, because always active learning is better than passive learning, and participation always creates a sense of involvement, acceptance, and it also improves the decision making. It also gives out a better positive feedback when compared to a passive learning. So, group discussions and panel discussions conducted among the people will give out a better participation results when compared to a one which is given only through a health educator. Next, coming to the fourth principle, that is motivation. Motivation is the fundamental desire for learning. Motivation is of two types. One is primary motive, another one is secondary motive. Primary motive is an inborn desire among the individual, which is of examples like hunger, survival, etc. These comes from the individual themselves and it does not need any external force to be given. Whereas a secondary motive is always it is coming from the outside source. So, it needs a health educator or anything that is given from outside, which is of example like prize, reward, love, punishment, etc. Punishment is a negative form of motive, whereas a positive form of motive is love, prize or reward. So, health education can be facilitated by motivation provided by the desire to achieve these goals. So, fifth one is comprehension. Comprehension is nothing but making the things easier to understand by the layman or the receiver, lower level of knowledge or health literacy. So, health educators should first determine the level of literacy and understanding of the layman or the audience before starting with the health education program. He should not use any medical terms or technical terms before the layman or the audience, and the words that are strange or newer ones should be avoided. For example, here I have given an example which shows that don't eat food items that are karyogenic. Karyogenic is a word that is more stranger or newer one to a layman, whereas when we say that avoid foodstuffs which are sweet and stickier in nature, this is more comprehensive, which is easily understandable by the layman when compared to the one which I said before. This is comprehensive. Next is reinforcement. Reinforcement is nothing but the booster dose in health education. Once we say about a particular statement in a population, we have to repeat it again and again so that it gets better into the minds of the people and it gets installed into them. So, this is a principle that refers to the repetition needed in health education, and usually people take longer time to learn something, and within a shorter period it is difficult for them to understand or to replicate the same. So, repetition is a good idea, and this needs to be done at regular intervals, which helps them to understand newer ideas and practice better. Next principle is learning by doing. If learning process is accompanied by new things, it is better instilled in the minds of people. It is based on the Chinese proverb that if I hear, I forget, if I see, I remember, if I do, I know. So, always doing something will be better installed into the minds of the people rather than telling or seeing something. The better example from our dental practices is brushing technique. Once a child or the parent is explained, they will just see it and they will just remember. Once they are asked to do, they will easily remember it and they can easily replicate the same. This is the 7th principle, learning by doing. Next principle is known to unknown. Before starting with health education program, the educator should find out how much the people are educated and how much they already know, what they can understand, and also the newer knowledge which we are going to give. So, using existing knowledge is the basic step on which new knowledge can be placed. So, it should follow this rule that from general things to a particular thing, and from an easy one to a difficult, and from known to unknown. For example, if we are giving a health education for a tribal population, means first we have to show them how the toothbrush will look like and what are the benefits of using it and what they are using and how it affects the population. For example, if the tribal population is using a charcoal, means how it stains their teeth and how it looks ugly, while if they are using a toothbrush, means how it will look like and how it is easy to use. These are the things we have to tell them before starting to giving them a brushing technique advice. Next, 9th one is good human relation. Any health educator should have a better human relationship with the population or the receiver, so that they will have a good communication in between them. Sharing information, ideas and feelings happen most easily between the people who have good relationship, and building good relationship goes hand in hand with communication skills of the educator. The health educator should have these qualities. First one is he have to be kind, sympathetic in attitude towards the people, should be helpful, clarifying their doubts and have good personal qualities, and should also maintain a friendly relationship with the people. These are the good qualities that are to be maintained by a health educator for a good human relation. Moving on to the next principle, that is the 10th one, it is feedback. For any program to be successful, it is necessary to collect feedback to find out any modifications are needed to make the program more effective. It is the key concept of system approach. If the modifications of the elements of health education are to be done, this needs a feedback to be obtained. Coming to the next principle, that is the 11th one, it is community leaders. Community leaders are ones who are living in that population and who are the heads or the ones who are known by the community people better. And the community leaders can be used to reach the people of the community. They understand better the needs of the community and they advise them, guide them and also convince the community about what is to be done about the health problem. And also they educate the people better well. Examples of community leaders in a community will be either the head of the village or the ward members or the headmasters of the school belonging to that village. Coming to the 12th principle, it is easier one, soil, seed and sower. Soil is the people or community to whom we are giving the health education or the information. Seed is the information which we give through a health educator, and the sower is the health educator, he or she himself who gives the health education. So, this is known as soil, seed, soil. These three things are essential for giving a health education program. So, coming to the last principle, setting an example. So, every health educator should be a good example for what he preaches. So, if he preaches the patients or the people to not smoke, means he or she should also have the habit of not smoking. If he or she smokes, the people will think that even if he himself has the habit, and how he can preach the same. So, this is the last principle, setting an example. So, coming to the conclusion part, health education is a cost effective way of approaching individuals regarding general and oral health. Applying these key principles enhances patient outcomes and health literacy. This in turn promotes a healthier society. Let us educate, empower and inspire the communities. With this, we come to the end of this discussion. We will meet with another interesting topic in the upcoming sessions.